Hello everyone, how are you guys? I decided to make this scientific video initiative in order to verify steam inhalations as a potential treatment method of early stages of COVID-19, or, to disprove this myth. To my best knowledge, there is only one small pilot observational study. Results seem to be very promising. Second purpose is to create a framework for rapid testing of any unverified claims, or magic treatments in the future by a rapid cooperation of a multidisciplinary team of public, marketers, crowdfunding specialists and scientists. My initiative is a pure work of love and realization of my scientific enthusiasm and goodwill for people around the world. We all know what immense losses due to COVID-19 we are experiencing. Many of us lost loved ones, were seriously sick of COVID-19 and have still some long-term symptoms. Parents and children are deeply suffering, many of us have existential or financial problems, lost jobs, many of us are frustrated, angry, depressed and anxious. Many of us gain a lot of weight, have very unhealthy new eating and sleeping habits, many new bad other habits, drinking more alcohol, smoking more cigarettes, we are more irritated, stressed, nervous and the list goes on. Future seems to be uncertain at this time. But I am 100% sure that it will be better soon for all of us. Now, we can appreciate this time and self-reflect and partly and very slightly feel how many people felt and are feeling during wars, or in very difficult circumstances of life. From that point of view, we are still living a very good life and should be in all the circumstances always very thankful and humble. Mainly we, from the wealthy parts of the world. We should be more sympathetic to all the people of the world and always give charity. Most of us are ordinary citizens, people living good simple lives and know and feel problems of others. We are not powerful statesmen like Putin, Biden, Jinping, billionaires like Bezos, Gates, Musk, Soros. We should always try to understand and feel the feelings of other people, without any obvious or hidden agenda, purely from the good of our heart and soul. So much for the brief introduction. The video is divided into 3 sections for clarity: background, main topic, outputs and solutions. Background deals with current scientific information about COVID-19, origin, prevention measures and its effects, pandemic fatigue. Main topic: provide current scientific evidence about steam inhalations versus COVID-19, outputs and solutions. Discusses about recruitment of public, marketers, crowdfunding specialists and scientific teams. I have only idea, but need your help. This solution is not in the viewfinders of investors, but high is the priority of public interest. Background: novel human coronavirus SARS-CoV-2 causing the COVID-19 disease started its career as main actor of pandemic in Wuhan, China at the close of 2019. And subsequently spread worldwide. Virus is likely to have passed from bats to humans, probably through an intermediate animal, but definitively ruling out the lab scenario, natural origin or another cause will be difficult. The emergence of SARS-CoV-2 pandemic has upset health systems around the world and caused immeasurable losses and costs. It can be deadly mainly in people over 70 years, people with comorbidities like cardiovascular diseases, diabetes mellitus type 1 and 2, obesity, asthma, allergies, chronic obstructive pulmonary disorder, reduced lungs functions, immunocompromised patients, like those with cancer, people with specific genes variants and others. For example, in the United States the case fatality rate is 0.003% for age group 0 to 19, 0.02% for 20 to 49, 0.5% for 50 to 69 and 5.4% for people 70 or over. Known are commonly known symptoms, but also various light to very serious short, medium and long-term negative health effects. There is a very high probability that as time will go and scientists and clinicians will work, we will know many more. COVID-19 is and will be one of the most researched diseases of the modern era of science and medicine. On the 11th March of 2020 WHO characterized the COVID-19 disease as pandemic due alarming levels of spread and severity, and by the alarming levels of inaction. After that the corresponding political and financial processes to release power and money in order to make necessary countermeasures were globally and nationally started. Many scientific studies of lower quality emerged. Misinformation, disinformation, misinterpretation, mixed messages, non-transparency, fake news and infodemic by some politicians, mass media, people on social networks and websites undermined the credibility of the solutions and the competence of some politicians. Even some of the WHO prevention and protection measures and WHO itself were questioned by public. The recommended basic prevention and protection measures by WHO remain physical distancing, masking, cleaning hands, opening windows, avoiding crowds. National responses were reduction of mobility, gatherings, effective stay-at-home orders, lockdowns or shutdowns of the countries. These measures were applied in order to flatten the pandemic curve in the most affected countries or areas, mainly during the peaks of main season. Many negative effects of long-lasting lockdowns on mental and physical health, economy and their consequences arose. Those information should always be taken into account when measures are considered according to experts. Potential benefits of the measures should always outweigh potential risks. Mix of all mentioned phenomenons caused pandemic fatigue and resistance of some people to respect authorities and prevention and protection measures. There are many scientific, investor and political debates if the monoclonal antibodies, other medicine, or vaccination by fast-developed vaccines will save people, health systems, economies and what other measures are possible. Scientists and research and development teams, crisis managers, investors and politicians all around the world are looking for all the methods possible for prevention and treatment of COVID-19. Several therapeutic protocols for clinical management of COVID-19 patients were established and are still developing in the light of new information. Treatment guidelines and pharmacological plus non-pharmacological protocols are released by NIH, CDC, WHO, other authorities, and many are derived or created de novo on the national levels. Still, there are many unsupported claims, misinformations and fake news about miraculous guaranteed home or alternative remedies or interventions of COVID-19. Many of them are evident ego trips, many seem to be logical and rational, many of them not, but, who knows? We propose to test them in the sound double-blind randomized controlled trial, but those methods are oftentimes not interesting from a commercial point of view, so, crowdfunding seems to be an option. Main topic: one of those rumored remedies is steam inhalation, inhaling heated vapor, or rhinotherapy. Steam inhalation, performed through a range of traditional and device-dependent techniques, has been used in the treatment of respiratory infections because of the theorized effects of heat and humidity on respiratory viruses, nasal secretions, inflammation, and airflow. Authors of the studies of various quality reports conflicting results from negative through neutral to positive in common cold and few others respiratory infections and complications. Many authors in their studies warn about this method because carelessness can end up with slight to serious burns. High caution should be exercised when using this method. SARS-CoV-2 virus-causing disease COVID-19 is thermolabile in a liquid environment, as was proven by several experiments. Authors of the Steam Inhalation study used water steams as potential treatment for thermal inactivation of SARS-CoV-2. They hypothesized the procedure, which if performed soon after contagion, would reduce the risk of progression to full-blown infection. It is based on Loeff's model, which demonstrates that raising the mucosal temperature to 43 degrees Celsius for 3 periods of 30 minutes each, at 2-hour intervals, blocks the replication of rhinoviruses after virus inoculation. Authors further stated that contagion occurs most often unknowingly, which does not allow a timely preventive procedure, unless carried on systematically in at-risk individuals, for example healthcare professionals working in COVID units or personnel in contact with the public. Although applying the Loeff's model to benefit pre-symptomatic and untested individuals would be unrealistic in a pandemic context, authors hypothesized that it would still be effective in abating viral load in asymptomatic or polysymptomatic individuals who test positive to RN swab and are both potentially infectious and at risk of symptoms worsening. Authors stated, "Our small study suggests that a protocol based on at least 4 cycles of 5 minutes, or 5 cycles of 4 minutes in 1 hour, 131 to 149 degrees Fahrenheit, 55 to 65 degrees Celsius, temperature of steam inhalation. It might indeed be beneficial in halting SARS-CoV-2 virus infection in the upper airway mucosa during the initial stages of infection and possibly preventing further spread. It could also be helpful in polysymptomatic subjects during the last period of infection, when the immune system is already active against the virus but its presence is still detectable in the upper respiratory tract. Since steam cannot reach the bronchial tree, bronchi and lungs, it is unlikely it could be beneficial once the infection has reached the deep internal airway mucosa. Our observation is only preliminary, it has obvious potential biases and the beneficial effects we observed need confirmation in a controlled trial. Authors finally conclude, should our preliminary observations be confirmed, the protocol could be used against COVID-19 or other viral infections using vapotherm masks, where temperature, time of exposure and size of steam particles can be set and monitored. In addition, other authors also support heat-based procedures as potential treatment of COVID-19, stating also psychological and physiological aspects of those interventions. Humidifying procedures of interior spaces were also suggested to protect nasal mucosa of dehydration and break of immunity mucosal layers. Traditional infection control pyramid adapted from the U.S. Centers for Disease Control also suggest potential means to manage the SARS-CoV-2 virus, and we will surely see more of some of them creatively and effectively applied to the practice in the future. Outputs and solutions. I would like to ask the public, we can all add a hand to the work, marketers and crowdfunding specialists to help this initiative, to start a sound campaign and make sufficient budget as a starting point. Then, we could attract teams of scientists to do the rest. There are many scientific teams in the world with the needed material equipment, personal resources, experience, knowledge and courage needed to design and execute sound double-blind randomized controlled trial on the topic. Are steam inhalations efficient in treatment of COVID-19? I can provide only this initial framework, an idea, but I need help from all of you guys. This steam solution is not in the main viewfinders of investors, but outcomes can be useful in either way. It could attract needed attention and then be further crafted as a treatment method of COVID-19, or, it can serve as a mythbuster of the myth. This multidisciplinary approach, public, marketers, crowdfunding specialists, scientists, could be used in many other scenarios, where interest of public health can be defended and realized mainly by rapid public funding, because of relatively low commercial potential and so disinterest of investors. This framework is freely available to use by anyone in any scientific project with only preliminary findings, but it is of great value of public interest. My initiative is a pure work of love and realization of my scientific enthusiasm and goodwill for people around the world. It would be nice to cite this video link there and let me know in the comments below. Please, if someone will start with this project, or have constructive ideas how to do it, I would be really glad for your comment or information. Thank you guys and good luck. Please, share, like, comment and subscribe.